Hello, my name is Dr. Ron Manzanero, and I want to welcome you to Austin Integrative Medicine. The purpose of this video is to give you a brief overview of how your experience here will be different from other medical practices. Just a brief background, I come from an interest of alternative medicine before I went to medical school into such things like nutrition, herbology, homeopathy. However, I didn't want to be limited by just that aspect of medicine, but also get the broader perspective of conventional medicine as well. All the practitioners here come from the conventional model, so when we see you for the first visit, certainly we're going to look at different diagnostic possibilities, different types of conventional tests, but we're also going to do more cutting-edge tests that perhaps the regular doctor is not going to think about. But even beyond that, we offer sort of a spectrum of possibilities of therapies and investigations that we can do. Personally, I have a keen interest in homeopathy, so when I see a person for the first time, I see them in a multi-dimensional manner, or kind of like an onion. We have different layers. So sometimes we'll deal strictly with hormones, nutritional evaluations, maybe heavy metal evaluations, to think more biologically. Some people have issues with sleep that disturb their adrenal gland function, so we'll look in that direction. But I'm always looking what's causing the sleep disturbance, what's causing the nutritional deficiency, what's causing the obesity problem, what's causing the fatigue problem. So we'll go to all these different avenues of different testing, but at another level, if we need to, I can even practice homeopathic medicine with you. We have practitioners here that also do light therapy to help with brain function. We also do intravenous vitamin nutritional supports for people who have cancer or have chronic fatigue syndrome. And because there are now well-documented links between toxic metals like lead and mercury with cardiovascular disease, we can even offer intravenous and or oral chelation methods. So that's one of the things that I'd like to make you aware of, is that when you come in, we're going to look at all these different layers and different aspects of your health, and there may be aspects that you yourself haven't even become aware of. It's not uncommon for people to come in and say, I have chronic fatigue, doctor, please check my hormones, when in fact they have a sleep disorder. But then when we go further, you can see the sleep disorders due to chronic stress that they have. A lot of times our repetitive thinking may have a negative consequence, particularly at nighttime. So we're going to look at multiple angles. We have multiple toolboxes that we can offer in terms of therapies and multiple diagnostic capacities.